back. The chair now recognizes Ms. Kuster from New Hampshire for 5 minutes.
Thank you, Mr. Chairman, and thank you to the witnesses joining us today for your testimony. In particular, I want to thank Mr. Delina, who's been such a great resource for us in New England. I really appreciate our work together. I'm co-chair of the Bipartisan Task Force on Mental Health and Substance Use Disorder with my Republican colleague, Brian Fitzpatrick, and David Trone of Maryland. And we are all grateful for the progress that this committee made in the 117th Congress, passing important mental health and substance use disorder legislation, and in particular, the Restoring Hope for Mental Health and Well-Being that I might add passed the House with 402 votes. I think it was probably the most bipartisan bill in the 117th Congress. But as we all know, there's much more to be done. I'm working closely with my colleague from Delaware, Congresswoman Blunt Rochester, to reintroduce our legislation, the Stop Fentanyl Act. And I hope that the chair will bring that up in a subcommittee on a future date. This bipartisan bill was introduced in the 117th to invest in fentanyl detection and data collection, stem the supply of fentanyl, and address demand for synthetics through overdose prevention and substance use disorder treatments. As Mr. Chester's testimony stated, fentanyl is a complex national security, criminal justice, and public health challenge that requires a multifaceted approach. And that's why the Stop Fentanyl Act devotes resources to enhance fentanyl surveillance, empowering officials at the state, local, and federal level to support detection and reporting. We must continue to aggressively pursue the sources of fentanyl that have been described here today, stopping the flow of materials for synthetic drugs into this country and cutting off the paths that bring these harmful substances into our communities. This bill supports efforts to hold bad actors accountable, both at the international governance level and with the social media companies that our families and friends use every day. As the experts in this room know, a public health approach must be complemented by a well-resourced, data-driven plan to stem the supply of fentanyl. Stop Fentanyl is the path forward to respond to the challenges before us, and I look forward to hearing from my colleagues on this committee who are interested in a comprehensive approach to protect our companies from fentanyl, our communities. I ask for your partnership and support. In order to best craft solutions, it's essential to definitively understand the problems. Mr. Delina, it's great to be with you, and I wanted to ask you, you've seen how these issues affect communities like my district in New Hampshire, and the DEA has worked to prevent shipment through the postal system and crack down on chemists overseas, as you described. What is the top way that fentanyl enters the country, and where should congressional efforts be focused to complement your agency's work?
Congresswoman, thank you for the question and for your work when it comes to fentanyl. A majority of the fentanyl that's coming into our communities crosses the southwest border, predominantly through the ports of entry, but they use any possible way to get it across.
And Mr. Chester, what role can HIDAs play in expanding our surveillance and data collection efforts moving forward?
Our HIDAs play a vital role because they're in all 50 states. They cover the vast majority of the population of the United States and 99 of 100 major metropolitan areas. They're the ones that can provide us the bottoms-up information of what's actually happening in their communities, and they provide this information nationwide. They're an extremely valuable resource.
And is there coordination and sufficient resources for data collection and surveillance to know, I heard a reference to a new substance today that I wasn't even aware of, but to know when there are emerging threats?
Yes, ma'am. In fact, the HIDAs are very valuable. Not only are they, do they work effectively in their own right, but they are networked together very well, particularly through their drug intelligence officers who are able to share that information and be able to determine nationwide trends based upon the local data that they're seeing from their particular HIDAs.
I think that data collection and surveillance is going to be really important. Dr. Gondortra, I'm going to have to probably leave this question for the record, but once fentanyl enters our borders, how does SAMHSA work with first responders to educate on interacting with fentanyl?
Thank you for that question. I will point to our grant program, the First Responders Comprehensive Addiction and Recovery Act, that educates first responders, firemen, police officers on how to administer fentanyl, how to recognize the signs for overdose, and how to link to care.
Great, thank you, and with that, I yield back.
Thank you. The gentlelady